And welcome back. Well, vein treatments have come a long way. You almost never hear stripping veins anymore, and now almost all procedures can be done in office with less pain.
That's great news, too. And Dr. Deborah Manjoney is the medical director of the Wisconsin Vein Center MediSpa, and she's here with the very latest on vein treatments and why now, in the dead of this dreary, gloomy winter, is actually a great time to do something about it. We'll get to that in just a second. But I think it's interesting to note that vein issues sort of run the gamut. They're all different levels.
There really are. They're just the little tiny veins on the surface, the spider veins that just look like little tiny spiders on the skin, you know, that are blue or pink.
That's cosmetic.
That's cosmetic,
right?
but it may be related to something else going on.
Okay.
But usually it's not, but it certainly can be. Then there are the varicose veins, which are the bulgy veins on the surface. Again, usually reflecting something else going on in the veins, and another vein that has to be treated as well. And then there can be, of course, the deep vein problems. It can be either deep vein clots or malfunctioning of the deep veins underneath the muscles, the real important veins that drain the legs.
What do all those things feel like? Do they all have symptoms?
The spider veins may or may not have symptoms. Frequently they'll have some throbbing in those on the surface, but varicose veins indeed can cause a lot of symptoms, as can veins that you can't see. And so if you have tired, achy legs, it's not just because you're aging or you're doing things in other ways. What's happening is the veins are draining the legs. Those are the vessels that are carrying blood back to the heart and lungs, so they're going against gravity. And so the veins rely on these little valves. They're located every 3 or 4 inches up the leg, up the vein. And if those valves aren't working, then blood is refluxing back down in the veins getting stretched out, bulging, and that's what's going to cause the varicose vein. And they're overfilled, so that's what gives you symptoms. Your legs are congested.
Okay.
What's the determining factor or factors as it relates to whether or not insurance covers vein treatments?
A lot of it is symptoms.
Okay.
So if the patient has symptoms and the veins have gotten to a point where certain insurance companies have size that they use as criteria. So if they're a certain size, and we tell all that with our ultrasounds that we do right in the office.
And that doesn't hurt to have
that
that
diagnosed. The ultrasound's totally painless. It's a diagnostic study we do with somebody standing up so we can see the effects of gravity. And then we're able to give that information to the insurance company in order to try to get certification to go forward.
So is that done more at a consultation?
We do the consultation, decide if a person needs an ultrasound or not. Then they come back for the ultrasound. I will see them at that point and tell them all about what the ultrasound shows right then and there. Then we write the letter to the insurance company. Sometimes they have to wear stockings, depending on their insurance company.
Whoa, is that the same leg?
Yes, it is.
Oh
Whoa,
my gosh.
because see, that's the thing is, what's interesting is varicose veins aren't considered cosmetic, but the cosmetic improvement with treatment is unbelievable.
Absolutely amazing. It really is.
Wow, okay. So most of this is done all outpatient?
It is all done outpatient.
All done outpatient.
Absolutely, everything's done just through the office. So if somebody has to wear graduated compression hose for a while, they have to do that, but then we can see them and get that letter sent in, get the approval for insurance to cover it. And it's wonderful to have these things taken care of.
We talked about glue as being this sort of new miracle thing with veins. So sclerotherapy is something that's been around for a little while. You talked about that before.
Sclerotherapy is injection. We're injecting a detergent that's FDA approved into the vein to get them to close off. And this is spider vein treatment where we do some sclerotherapy and some surface laser to treat those. Very quick procedures, and it's really virtually painless. You barely feel the needle because it's so tiny. So that's how we treat spider veins. We also may use sclerotherapy on a little bit bigger vein, but not the huge varicose veins. Those ones usually have to be removed, or we wait for them to shrink down after we've treated the source of the problem, which is often what we call the trunk vein of the superficial veins, meaning the veins between the muscle and the skin, the great saphenous vein or the small saphenous vein. And we've been treating those now for 15 years in what we call an endovascular technique, where we thread a little something up inside the vein and close the vein from the inside instead of stripping it out.
Oh, okay.
And so that's been the major advance in vein treatment in the last 18 years, that we can close it. And we usually use what we call a thermal method, a laser or a radiofrequency heat to close the vein, to actually injure the inner wall of the vein as we're removing the catheter, and that closes it off. Now we have other things like glue.
Yeah, what's up with the glue? Is it like school glue?
Super glue?
No, it's not like school glue, but it is a surgical glue that has been
sniff
used now for many years, but now this has had a little softener or a plasticizer put in it. So what we do is we thread this little tube up inside the vein again through just one little needle stick that we've numbed up the skin for, and then we put little dollops of glue and press down, give it time for it to close, and we just keep withdrawing, putting more and more little drops of glue down. It's less than a cc of glue, 1 to 3 cc's of glue.
How are you pushing that vein down?
Just by manually compressing on the surface of the skin.
Wow.
So we're pressing down on the leg over the course of the vein. We're using ultrasound to see everything, so we see exactly what's going on.
A lot of people will say, well, if you get rid of these veins, what happens? Do the other veins then bulge out? Do you need those veins?
You do not need the veins that aren't working properly, because you've got so many veins in your legs that are working well. But that's what the whole evaluation with the ultrasound is going to show us, which veins are working, which ones aren't. As long as you have well-functioning deep veins, we can do all these things, no matter, even if you have recurrent varicose veins in another area.
It's really exciting, this new treatment, and this is a good time to have your legs treated before summer.
Absolutely, because summertime actually people are more symptomatic because the heat makes the veins dilate more.
Oh,
you get more leg swelling and problems there too.
Heaviness.
And you don't have to wear stockings, you don't have to hide anything. You know, bruising, anything's going to be all gone by summer if you do it.
Do it now.
Yeah,
all right.
Act now, because insurance might even cover it too. It's worth definitely having it diagnosed, especially if you have symptoms. Call now and make an appointment. It's 262-746-9088, wimedispa.com, and you'll be able to tell from that assessment which type of treatment is appropriate for
We'll be able to give them recommendations. Absolutely.
Wonderful.
That's great.
Great to see you.
Thank you.
Have a good weekend.